will talk today about microneedling. A lot of people keep asking me, what is microneedling and how does it help? Microneedling is nothing like, it's exactly what the name says. Micro, which is small, needling is needling. So needle is very, very, very tiny, small little needles. But how deep it can penetrate in your skin depends on the length of the needle. It could be 0.5, 1, 1.5 mm, 2, 2.5, 3, 3.5 is the maximum usually which is used. Lesser than 0.5, like a 0.1 and a 0.2 is usually what's used as a home gadget, which people buy off the internet and use, which I'm really not very big fan of, because that can really carry infection, things can go wrong, it can cause bad scar tissues. So therefore you need to be very careful of that. But in a doctor's office, what are the microneedling that you do? Usually there are 2 options or 3 options. One is simply a microneedling, which is also called as a good old dermal roller. Little needles around a little cylinder which is rolled on your skin. I'm going to show you that procedure next. But first we will show you an even more sophisticated procedure where around 25 microneedles go in and out of an automated gadget, and once they are in, there is a blue light which is a very healing light which also releases. Along with it, there is radio frequency. And how does these 3 things help? Blue light helps in healing, like I said, so wonderful for acne skin or for aging. What is aging ultimately? A slow wound, isn't it? So it helps skin heal really well. 2, the needles itself cause micro injury, therefore stimulates collagen, and your brain thinks there's a lot of injury, goes into an overdrive of making your collagen. So therefore it kind of starts to make your collagen and elastin and growth substance. When a base cell is stimulated, it is stimulated to form all of this, not just one of that, right? And then you have radio frequency. Depending on whether I want to release the radio frequency all along the needle or just on the tip of the needle, I shall choose my parameters. And then that radio frequency, when I want for an anti-aging, helps in anti-aging because it again is a very stimulatory thing. But when I want for acne, it also shrinks my oil glands. So it works brilliantly for acne, oily skin, open pore skin, all of this, when there is no real cause that as a physician, as a dermatologist, what I can treat. But we need to do something more mechanical to actually reduce the oil gland secretion. That's what we do from the top. And then there are various other gadgets like derma pen, which is a smaller little pen with tiny little needles. So it's nice and fancy to use a pen. But net, it is just this. Micro needling, which is going in, either micro needling on its own or micro needling combined with the radio frequency. Now on top of this, I may choose to use some serum because I've already caused channels now in your skin. So I may use serums into it. I may use a PRP with it. Anything that I think will add more value to the injury that I've caused on the skin. So first today, I'm going to show you microneedling with radio frequency. So while I prepare, look at the gadget. Yeah. So this is the gadget. Can you see? Each time I press, there are needles that are coming in and going out. And there are 25 such needles, and that is what will go into the skin right now. So she's already prepared with a numbing cream. And I'm now going to use this gadget. There you go. And in my skin, and my clinic, I like to do every single thing on my own, right? Because I think equipments are equipments. Yes, of course, we get the best equipments here, the world-class ones. I set the equipments, choose the gadgets, choose the parameters on my own. Having said that, how it is administered makes a really, really big difference. Yeah, all this is just a tool, right? What actually gives you the result, what creates that magic, what gives you the result is your doctor's expertise and how she administers those things. So there you go. That is microneedling.